Assalamu alaikum. Dear student, I am Dr. Anisa Sadiq, Senior Registrar, Gynae. Today the lecture will be on subfertility. The subfertility, it was previously called infertility. Now the nomenclature has been changed to subfertility. So some people are using the term infertility and some are using subfertility. But nowadays it is used as subfertility. Okay, infertility and subfertility are same thing, but only the nomenclature has been changed. Now, the learning objective. The learning objective will be that at the end of the lecture, you people should be able to know, understand the definition and causes of subfertility, mean that what is subfertility, what is the definition of subfertility, and what are different causes of subfertility. And you people should know, describe the concept of ovarian reserve. I will be giving a lecture on, in the next lecture, I will explain that what is ovarian reserve, okay? And at the end of the lecture, you people should be able to take a history from the patient or from a couple having subfertility. In the history, you will take which points you will take in the history from a patient or a couple suffering from subfertility, and for which thing you will see in examination in a couple with infertility, and which investigation you people will prescribe to a patient suffering from subfertility. Now, the definition of subfertility. What is subfertility? I mean, there is no universal definition of subfertility, but the commonest accepted definition which was frequently used and it is accepted as is that is the failure to conceive after 12 months of regular unprotected intercourse. Mean the time duration will be 1 year, and the second thing will be that the couple is living together. Mean that after 1 year of regular unprotected intercourse. Unprotected means that the patient is not using any method of contraception. Despite of this, the patient is not conceiving. So the definition is failure to conceive after 12 months, mean after 1 year of regular unprotected intercourse. If the couples are not living together and the 1 year is spent, then we are not labeling is subfertility. The living together is must for the couple. So the definition will be failure to conceive after 12 months of regular unprotected intercourse. Nowadays, a delay in conception is one of the commonest reasons that a woman will consult her doctor. If you are going to gynae or in some clinic, you will be seeing that every 7 women is coming for infertility treatment. Okay, the incidence is very high. That is 1 in 7 couple is seeking advice or searching medication for the treatment of infertility. Now, there are 2 types of subfertility. Two types of subfertility. One is primary subfertility and the second is secondary subfertility. The primary subfertility is the couple have never conceived altogether. That the primary subfertility, the couple have never conceived altogether, that not becoming pregnant previously. It is called primary subfertility. And the second term is secondary subfertility. And secondary subfertility, the patient has previously conceived, or the patient has previous abortion, kids, or ectopic pregnancy. After that, the patient is not conceiving now. Then we are labeling is secondary subfertility. And the secondary subfertility is that the patient is not becoming pregnant from any partner. if the patient couple has second marriage of the husband or second marriage of the wife, from the first marriage they have conceived or they have pregnancy, then after second marriage they are not conceiving, then it is also included in secondary subfertility. Secondary subfertility mean that the patient has previously conceived, but after that the patient wants more kids, or the patient want to conceive but it is not conceiving again, then it is called secondary subfertility. So primary subfertility and secondary subfertility. Now, one thing is natural conception. Natural conception is very important to understand, because the couples are not waiting for the natural conception. After marriage, in first 2-3 months, the patient are seeking advice, but it is not suitable and it is not advisable to seek so early for the conception, because there is natural conception rates. Mean a healthy couple having frequent intercourse have about an 18 to 20% chance of conceiving in a single menstrual cycle. Mean if the couple is having regular intercourse, then in a single cycle, the patient is having 18 to 20% chance of conceiving. Okay, in single cycle, mean in 1 month, the patient is 18 to 20% chance in 1 month. Okay, but and the incidence is the rate of conception is increased within 6 months. Within 6 months, almost 70% couple conceive in 6 months. 70% couple. Okay, in after 1 year, almost 80% couple will conceive. After 1 year, if the patient are waiting for 1 year, that is why after 1 year we are labeling the patient as infertility or subfertile, but the patient are not waiting to 1 year, because naturally the patient will conceive within 12 months or within 1 year. 80% will the couple will conceive spontaneously, not without any medication. And after 2 years, if the patient is waiting for natural conception without using any medication, then after 2 years, almost 90% couple will conceive. Okay, so the wait is very important. Almost 2 year wait is important before seeking any advice, any infertility investigation, any treatment for infertility. Wait for the natural conception is very important. Now, female fertility tend to fall sharply over the age of 36 and with a further dip over the age of 40. The female age is very important, because with gradually increases ages, the number of follicles are declining and the number of ovate is decreasing. So with advancing age, the chances of subfertility increases in female. Male is also an important factor. Semen quality tend to fall in men over the age of 50. After 50 years, there is much gap in the female and male age. The female become quickly depleted of the ovarian reserve, and the male ages up to 50. After 50 years of age, the semen quality tend to fall in men over the age of 50. And the frequency of intercourse tend to fall in men over the age of 40. After the age of 40, the frequency of is decreasing. So the chances of fertility is also decreasing. So age is very important. Both the frequency and timing of sexual intercourse impact strongly on the chance of conceiving naturally. Increased frequency of intercourse should be encouraged in the peri-ovulatory periods, mean around the cycle when the ovulation is occurring. So encourage intercourse at that time, many peri-ovulatory stage. So the chance of conception will be increasing. Mean if the couple is having intercourse 3 times a week, are 3 times more likely to have conceive, then couple having intercourse once a week. Maximum efficiency is probably intercourse at least every alternate day. Means in natural conception, eggs are thought to be fertilized for about 12 to 24 hours post evolution. If the eggs are released from the womb, if the egg is released, it should be fertilized between 12 to 24 hours. After that, it will be not working. And if the peri-ovulatory stage, the intercourse occur, then there is maximum chance of conception. And the sperm can survive in the female reproductive day for about 72 hours. Mean if the couple has intercourse 3 days before or 3 days after the post ovulation, then there will be chances that the patient will conceive. One thing is the fertile window. In the fertile window, it is the fertility periods. It is called fertile window, and it depending on the average length of the menstrual cycle of the female. It is varies in different female according to the length of the menstrual cycle. Mean if a woman has 28 days regular menstrual cycle, her optimal fertile window will be between 12 to 15. Mean 12, we are considering that evolution occurring at 14 days. So before day 14 and after day 14, it's called the fertile window, and this is the maximum time when the couple are doing intercourse. There is chances that the patient will or the couple will conceive. So the fertile window is the time where maximum chances of conception, and the patient has or the couple has intercourse during this time, then there will be chances of conception. So for conception, the avail the fertility period is very important. Yeah. There are certain external factors which are influencing the chances of conception. Mean if some male or female is doing smoking, if the in male it is affecting the quality of the quantity of semen, but not as much as in female. In female, the smoking can decrease smoking in female. Okay, in female, smoking can decrease the quality and quantity of egg. Okay, in male, it affects the quality and quantity of sperm. And the second is the body mass index. If the patient is so much obese, or the patient is so much lean and thin, both extreme, obesity and malnutrition, affecting the chance of conceiving. Okay, and one thing is stress. Stress is very important. Stress can have direct influence on the hypothalamic pituitary ovarian axis, interfering with the regular evolution, and may indirectly reduce conception by reducing libido and frequency of intercourse. If the patient is intense, there will be decreased libido and there will be decreased frequency of intercourse. So stress is affecting the hypothalamic pituitary ovarian axis. All women trying to conceive should commence taking folic acid before pregnancy. Should commence taking folic acid to reduce fetal neural tube defect. Okay, so certain points in natural conception are very important. And one thing you people should remember, that the couple should wait at least for 1 year, 1 to 2 years for natural conception. Now, what are the causes of subfertility? Around 30% cases are by male factor. Male factor are involved in 30% of cases. Female factor are also involved in 30% of cases. And in 25% cases, there is unexplained infertility. Mean the male investigation, treatment, everything is normal. The female, everything is normal. Despite of this, there is no reason to find out infertility. So 25% of patient couple who unexplained infertility. And in one, when the patient is having, couple is having one explained infertility, there are 25% patients are suffering from unexplained infertility. And most, and these couple, sometime in their life, they will conceive. And 15% are suffering from other causes of infertility. No male, no female factor involved, but the patient is not conceiving. Now, female subfertility. Female subfertility, it is divided into ovulatory disorder, tubal damage, and uterine disorder. Main things are these three. Ovulatory, remember it, okay? One is ovulatory disorder, tubal damage, and the third is uterine disorder. These three are main causes of female subfertility. One is ovulatory disorder, tubal damage, and the third is uterine disorder. Okay, these three are the main factor. If there is something wrong in these three factors, the female will be suffering from subfertility. Now, specific gametes are embryo defect at that level, and endometriosis are also contributing factor. As I have already told you, that smoking also reduces fertility, and the patient is having other general medical conditions like diabetes, epilepsy, thyroid disorder, and bowel diseases. They have also, here is also reduced the chance of conception. Medical disorder also affecting the fertility. Okay, and the one thing is the decreased ovarian reserve, decreased ovarian reserve. Decrease ovarian reserve when the ovary has less follicle. And age, as I have already told you, that female age is very much important, because with advancing age, the ovarian reserve are decreasing. The follicle are, with every menstrual cycle, one egg is released, and when the patient has delayed marriage, then they are enter the marriage, or they enter the and the marriage will decrease ovarian reserve. Mean they have already ovarian reserve is reduced. Other factor also decreasing the ovarian reserve. When the patient is having decreased ovarian reserve, so there will be chances of subfertility. Decreased ovarian reserve and age are major factors in reducing fertility. Now, as I have told you, three types in female subfertility. One is ovulatory disorder, one is tubal damage, and the third is uterine disorder. In ovulatory disorder means that there is ovulation problem. In ovary, the ovulation is not occurring at the menstrual cycle are in ovulatory. Cycle are regular, but they are in ovulatory. The ovary is in the eggs is not releasing, and the next cause of problem with ovulation is polycystic ovary syndrome. Polycystic, as I have already given lecture to you people on the polycystic ovary syndrome, in which I explained to you people that in polycystic ovary syndrome are in ovulatory cycle, in ovulation occur, and patients are more prone to polycystic ovary syndrome. Women with PCO, women with polycystic ovary syndrome who are suffering from oligomenorrhea due to involution may require treatment. In patient, as I have told you in lecture, that patient with PCO are suffering from oligomenorrhea and involution. When we are prescribing drugs for the treatment of polycystic ovary syndrome, for the regularity of menstrual cycle, and for the hirsutism from which the patient is suffering in the subfertility, when we are prescribing these medication are, on the other hand, also causing subfertility. So the treatment of PCO, when patients are taking treatment of subfertility, at that time the patient is difficult to conceive. Now, in ovulatory disorder, the most important thing in the ovulatory disorder is polycystic ovary syndrome. Okay. Now, hypothalamic disorder mean hypothalamic hypogonadism. Pituitary diseases mean hyperprolactinemia, in which the prolactin level is increased. Hypothalamic disorder, pituitary diseases, and endocrine abnormalities. like thyroid diseases are also lead to an evolution. Okay, an evolution. In evolutive disorder, the most important is polycystic ovary syndrome, but in hypothalamic disorder like hypergonadotrophic hypogonadism, the gonads are gonads have some problem. And pituitary diseases like hyperprolactinemia and endocrine abnormalities like thyroid diseases are less common causes which lead to an evolution. Now, in female subfertility, the second is tubal factor. Tubal factor are most of the couple in female subfertility having tubal factor damage. Tubal damage is usually associated with inflammatory process, inflammatory process in the pelvis. When there is inflammatory process in the pelvis, such as pelvic inflammatory disease, PID, or endometriosis, it lead to tubal damage and tubal blockage. Tubal blockage. When tubal blocks, then there will be no passage for the transfer of the ovum and the sperms. So it lead to tubal blockage. One thing is chlamydial infection. Chlamydial infection, chlamydial infection in particular can produce significant degree of tubal damage, resulting in hydrosulfins. Hydrosulfins. In hydrosulfins, there is long fallopian tube open with thick wall. The wall of the fallopian tube become thick. The ciliated epithelium become flattened, and peritubal adhesion occur. Peritubal adhesion occur. This is very important. The cilia in the fallopian tube is very important for the movement of the egg and sperm. When chlamydial infection, the epithelium become flattened. Okay, the wall become thick and they are less motile. So there is increased chances of ectopic pregnancy, and there is increased chances of subfertility. So the tubal factor and tubal blockage and PID and endometriosis is important. If the patient is having previous pelvic or abdominal surgery, it can result in post-operative adhesion. Post-operative adhesion occur. If patient has having previous history of the pelvic surgery or abdominal surgery, after surgery their adhesion occur, and so the tube become the patency and the function of the tube become compromised. Normal tubal function require both patency. Mean if the tube is present, then two things are important. One, it should be patent, and the second, it will be working. Mean a healthy anatomy and physiology for the needs and embryo transport is important. If it is compromised, then the patient is probably suffering from subfertility. Now, in female subfertility, one thing was ovulatory disorder, the second was tubal damage, and the third is uterine problem. In uterine problem, if the patient is having uterine fibroid, mean if fibroid is also causes infertility, interfere with fertility. Fibroid interfere with fertility. If there is submucosal fibroid, then there is increased chances of subfertility. The implantation will be difficult to occur in submucosal fibroid. Submural fibroid and subserosal fibroid little interfere with the fertility. The fibroid which affecting fertility conception is the submucosal fibroid. Submucosal fibroid, there is decreased implantation, and also when the implantation occur, there is chances of abortion. The patient is having subfertility. The subfertility uterine problem, uterine fibroid, whether affecting the fertility or not, it depends on the size of the fibroid and the site of the fibroid. What is the size of the fibroid and where it is located? Some people having big fibroid, but still they are conceiving. So if they are away from the tubal insertion, where the tube is inserted into uterine cavity, if they are away from that point, okay, then the patient is conceiving. And second thing is intermediate polyp. The intermediate polyp is also same mechanism for subfertility, that they are not, the patient is difficult to conceive with endometrial polyp. With endometrial polyp, the implantation difficult to occur. The third thing is endometrial scarring. And endometrial scarring, it occur endometrial scarring. How scar occur endometrium? Endometrial scarring, it is called Escherman syndrome. It occur either from uterine surgery, if there is some surgery occur on the uterus, or if there is some infection, then there will be lighter period and significantly reduced chance of conception. The patient is having endometrial scarring. So these are all causes of female subfertility, mean ovulatory disorder, tubal factor, and uterine problem. Now, male factor. What are the male factors which are involved in the subfertility? If there is compromised sperm number, mean the quantity of sperm, or quality is also important. If the sperm are present in normal amount, but if they are immotile, if there is subabnormality in the sperm anatomy, then it will be not proper for the fertilization. Sperms are also damaged by inflammation like bronchitis and uveitis. So the mature sperm can be destroyed. If there is some infection occur, inflammation occur, then it lead to destruction of the sperms. So the semen quality will be affected. And there are some iatrogenic influences, I mean iatrogenic causes, which lead to affecting the quality of semen. Pelvic radiotherapy or some surgery. Mean if the surgery is performed for undescending testes or torsion in the testes, then it reduces sperm production or damage or block the male reproductive tract. If there is some surgery, mean surgery is performed for the surgery is performed for the torsion in the testes, undescended testes, or there is radiotherapy to the pelvis, then it will affect the production of sperm and it will also block the male reproductive tract and it will lead to azoospermia, oligospermia, stenospermia and affecting the subfertility. And male medical condition such as diabetes also affecting the fertility, and there are certain occupations which are involving exposure to chemicals or radiation are also associated with male factor subfertility. In male factor, if the semen is normal, the quantity is normal, but the patient is still not conceiving. Then other factor like erectile difficulty, patient is having everything normal, but there is erectile difficulties. Erectile difficulties are the problem with ejaculation, premature ejaculation, not ejaculating, problem with ejaculation. These are also leading to subfertility. Then other thing is genetic causes are male factor infertility. And genetic causes, the one thing is aneuploidy of the sex chromosome, mean if the male is suffering from some syndrome like Klinefelter syndrome, XSY, Klinefelter syndrome, or structural abnormality of the autosomes, structural abnormality such as inversion, deletion, or balance translocation of the chromosome. Mean defect occur at the chromosomal level, then the patient is also suffering from subfertility. These things, micro deletion of the azoospermic factor, region of the Y chromosome. These are associated with low sperm count and motility. Low sperm count and motility. So the some defect are with the production of the sperm some are with the transport of the sum, and some are genetic factor. These all factors leading to difficulty in conceiving mean subfertility from male side. Now, the today lecture was on the natural conception. What is subfertility? Natural conception, and male and female factor are male and female factor causing leading to subfertility. So this lecture will be continued in the next lecture. In the next lecture, I will explain you what investigation, how you will take history from a couple seeking advice for subfertility, how you will perform the examination, and what is ovarian reserve and investigation. In the next lecture will be on this. Okay, the lecture is not complete, but I think this is enough for the today lecture. Okay, thank you so much.